With a condition like heart failure, it is important that you monitor changes in your condition and your overall heart health. Today we are going to be talking about different at-home and laboratory tests that can be used to monitor your heart failure status.
So what does blood pressure tell us? It tells us how much pressure your blood is exerting against your artery walls. Normal blood pressure for most adults is defined as a systolic pressure, the top number of less than 120, and a diastolic pressure, the bottom number of less than 80. Individuals can measure their blood pressure by going to Shoppers pharmacies, their family doctors, or they can even purchase one at Walmart, or we even have some here at the clinic. Common brands include LifeSource or LifeBrand. So to measure your BP yourself, find a quiet and calm place to sit. Roll up your sleeves and rest your arm around heart level. Slide the cuff onto your arm, usually we use the left one, and wrap it around your bicep, around 1 inch above the elbow, so that it's snug but not too tight. With a digital device, press the power button, a display will appear and it will generally immediately begin inflating. Sit still and try not to talk during this process. After a while, it will begin deflating and then there will be a long beep, marking the end of the process. Make sure to write down or save the reading. We usually ask patients to do this 2 to 3 times per sitting and at least once a day. There are a number of things that can affect your BP, such as stress, anxiety, or doing physical activity right before doing your reading. We ask patients to regularly take measurements, as then we can better notice changes and irregularities when we have measurements taken over a long period of time. Elevated blood pressure is defined as a systolic pressure between 120 and 129, with a diastolic pressure of less than 80. If your blood pressure is consistently lower than 90/60, you have low blood pressure. Blood pressure between 120/80 and 140/90 is still considered normal. However, most doctors will recommend lifestyle changes if you are in that range. Above 140/90 is considered high blood pressure or hypertension. Hypertension or high blood pressure is a common condition in which the long-term force of blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease or cardiovascular heart failure. Blood pressure measurements of above 180/120 are considered stroke level and are dangerously high, which may require you to seek immediate medical attention. A BP machine will also generally have a pulse recording. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. Generally, a lower heart rate at rest implies a healthier heart and better cardiovascular fitness. Individuals with a problem with heart failure is that the heart isn't pumping out enough blood each time. And to maintain your cardiac output, your heart will try to beat faster, leading to an increased heart rate. There are many tools out there that you can use to track your pulse, such as smartwatches and Fitbits.
A rapid gain in weight, whether that be more than 2 or 3 pounds in a 24-hour period or more than 5 pounds in a week, can be indicative of a worsening heart failure condition. And this is because heart failure can promote fluid retention and accumulation, which can cause your weight to go up. Therefore, it's always a really good idea to be tracking your weight and letting your doctor know if you notice any sudden changes, whether that be an increase in your weight, a sudden gain, or a decrease in your weight, a sudden loss. You can keep track of your weight by weighing yourself every day and keeping a record of your daily readings. That way, if there is any changes to your weight, it's going to be very apparent to you. One way that you can make sure that your readings are as accurate as possible is by weighing yourself at the same time every single day. So for instance, you can weigh yourself in the morning. And weighing yourself in the morning is a really good idea because at that point, after you've urinated once you've woken up and you haven't eaten any food, you're carrying the least amount of extra weight that you're going to be carrying throughout the day. So on top of weighing yourself in the morning, some other tips that you can keep in mind to get the most accurate reading possible is to be using the same scale every day, as well as to be weighing yourself either not wearing anything, undressed, or by weighing yourself wearing the same clothing every single day. So there are a few different ways that doctors can test for heart failure, 2 of which being a BNP test or a brain natriuretic peptide test, as well as a Pro-BNP test. Now, BNP is a hormone that's released by your heart in response to stretching of the ventricles, which are the cavities that are present in your heart that blood passes through, and its release functions to stabilize blood pressure as well as plasma volume to account for any increase in blood volume that's passing through your heart that could be causing ventricular stretching. And by doing this, BNP helps reduce ventricular stretching as well as reduce the amount of stress that your heart is experiencing. Pro-BNP acts in a similar way, and like BNP, will increase in concentration when the heart isn't pumping blood the way it normally should be. So because of their functions, these hormones tend to be very helpful indicators when diagnosing heart failure. And generally speaking, if your BNP levels are less than 100 picograms per mil, you'd fall within the normal range. However, in patients with suspected heart failure, high levels of BNP fall around 900 picograms per mil in 50 to 75-year-olds or above 1,200 picograms per mil in older adults. These levels can generally support diagnosis up to 90% of the time. However, some patients might have elevated BNP levels without having heart failure because of other ailments that they may be experiencing, whether that be severe lung disease or kidney disease or various other ailments that can increase your BNP level. So irrespective of the number that you get on your results, it's always very important to be discussing your BNP results with your doctor afterwards. For pro-BNP, normal circulating levels in patients that are aged 74 years or younger is less than 125 picograms per mil, whereas levels that are less than 450 picograms per mil are more appropriate for patients that are aged 75 to 99 years old. Pro-BNP levels that are greater than 450 picograms per mil in patients under 50 are considered to be elevated, whereas levels that are greater than 900 picograms per mil in patients aged 50 and older are considered to be elevated. Again, always very important to be checking your results with your doctor and discussing them before you're concluding anything regarding your risk of heart failure or your stage of heart failure. And these tests, both the BNP and the Pro-B level tests, can be ordered through a requisition written by your doctor and are no more than a simple blood test.
So you may have heard Dr. Kearney telling one of his students to add Lp(a) to your blood requisition form. So what he's referring to is known as a lipoprotein A test, which is a measure of the amount of lipoprotein A in your blood. Now, this is a low-density lipoprotein, or LDL particle, which has an added apolipoprotein A attached to it. It's quite a mouthful. Now, this test can be useful in assessing your risk of heart failure, with higher scores correlating with increased risk of cardiovascular complications. Elevated levels are defined as equal to or greater than 50 milligrams per deciliter, at which point your physician might consider taking a more aggressive approach with treatment and prevention. We also want to talk a bit about the Kansas City Cardiomyopathy Questionnaire, which is a very useful self-administered 23-point test that assigns a score to the symptoms you might be experiencing and can be used to evaluate heart failure status. The scores from each question are combined for a total of 100, and scoring from 0 to 25 indicates that your heart health is very poor. 25 to 50 would be poor or fair, 50 to 75 would be fair or good, and anything greater than 75 would be considered excellent. That's especially important to do this test monthly, and if you notice that your score is decreasing, it could indicate that you might have heart failure. Now, at this point, it would be important that you discuss this with your physician, and it's also important that we mention that we have a full video and webinar dedicated to the KCCQ because it is a very useful and important test. So be sure to check those out for more information.